Hi guys, welcome to the Massage Tutor. My name is Joelle and this is my friend Sammy. And today we are going to go over the hamstring muscles. I will be referencing this textbook here. I'm stuck. This textbook here, Trail Guide to the Body. So if you have any questions about perhaps where I've gotten my origins, insertions, actions, that kind of thing from, it is this textbook here that I reference to. Of course, there's all kinds of textbooks out there. Some of them will differ a little bit from each other, but the basics are the same. So I will be using my rubber bands here, my trusty rubber bands, just to kind of try to give you a better idea of the actual movement of muscles, the way they move, the way they cross over joints, and when they contract, how they're going to move a joint or create movement in a joint. So we're going to do that just to kind of give you a visual. So the hamstring muscles are on the back of the thighs here, the back of the thighs, and there's 3 of them. We have biceps femoris, semitendinosus, and semimembranosus. So biceps femoris, just like his name says, he's a 2-headed muscle on the femur. So biceps femoris, 2-headed muscle on the femur. All 3 of your hamstrings are going to originate here on this ischial tuberosity, or as we commonly call it, the sits bone. I'm going to come a little bit closer to you guys so you can possibly see a little bit better. So the ischial tuberosity, or sits bone, as we tend to call it. So when you sit, those are the 2 bones you should feel when somebody says, you know, you sit on their lap and you have a bony butt. This is what they're feeling here. So ischial tuberosity. And then he is going to have 2 origins because he is a double-headed muscle. So grab my rubber band here. So his first origin is going to be, again, that ischial tuberosity here. And then he's also going to be on the lateral linea aspera. So that linea aspera is this bony ridge here on the back of the femur, and he has 2 lines or ridges on the either side of him, so 2 kind of divots. So he's going to be on the lateral side here. Sorry, I touched the other side. Lateral linea aspera here. So he's going to have his long head originating on the ischial tuberosity, and his short head will be originating here on the lateral aspect of that linea aspera, and then he's going to come down and insert onto the head of that fibula. So 2 heads, one is going to cross the coxal joint or that hip joint, and the other one, the short head, he's only going to cross that knee joint, that tibial femoral joint. So, and again, he's going to insert on the head of that fibula, that tiny little bone right there, and he's going to insert on the head of that. So that's the origin and insertion of the biceps femoris. So again, because we're crossing 2 joints, when this muscle contracts, we're going to have at least 2 different actions. So of course the hip is a ball and socket joint, so we can move in all different kinds of directions. So his main actions are going to be directly on the posterior side of the body of the coxal joint and that tibial femoral joint. So long head, ischial tuberosity, all the way down to that fibula there. But the long head and short head both, they're going to have the action of extension of the hip. Extension of the hip. So from the side here, we'll put Sammy to the side. We're crossing ischial tuberosity, going all the way down to that fibula, and he's going to shorten and extend that hip. So pulling that leg backwards, okay? Because we also have that other short head, long head that's going to go down to the fibula, of course we're gonna have an action on that knee as well. So he is going to do flexion of the knee. Let me pull him back a little bit more so we can have a better look at how that looks. So flexion of the knee. That muscle is going to contract, shorten, and pull that insertion towards that origin. Of course, we can go back further and do extension of that hip. So those muscles are going to contract and shorten. They're going to flex that knee, extend that hip. So of course the opposite then of that is going to be stretching those quadriceps. When this one contracts, this one is actually going to stretch, and vice versa. So when that hip is going to flex and extend from the quadriceps, we're actually stretching and lengthening those hamstrings. Another thing that the hamstrings do, all of them do, is going to cause a posterior tilt in that pelvis. So when especially they're very tight, they tend to pull our pelvis in and cause that shortening, or when they are shortened, it causes this pelvic tilt, this posterior pelvic tilt. So a lot of times you will see when somebody lays flat on their back, it's hard for them to lay with nothing under their knees because it's going to pull their hips up because these hamstrings are tight. Hence one of the reasons why we tend to put a bolster under the knees to help relax that pelvis and shorten those hamstrings. Of course, we also do the bolster to protect that knee joint when doing a massage. But this is another reason, because when you have that posterior tilt, you have that curve, exaggerated curve in the lower back. So when you try to lay down like that, that's going to put even more pressure on that lower back. We bend the knees and we relax that pelvis and help to put some length into those hamstrings and take that pressure off of the lower back. So then we also have the semitendinosus and the semimembranosus. So one good thing you can remember is that the semis are together because two semis will make a whole, and that the membranosus is medial. So your semis are going to be on the medial side of the leg. Biceps femoral on the lateral side, membranosus medial along with his buddy semitendinosus. So membranosus medial is a good way to kind of remember the placement of the semi muscles. So we'll start with the semitendinosus. Semitendinosus is going to originate again on this ischial tuberosity, and then he's going to go all the way down, and he's actually going to go towards the front of that tibia. He's going to insert on to the front of that tibia at the pes anserinus. So this proximal medial shaft here, proximal medial shaft of the tibia. So proximal meaning towards the top of the bone, medial because it's towards the middle, at the pes anserinus, which is a three-pronged tendon made up from two other muscles, so three muscles total. So this pes anserinus, that three-pronged tendon, the turkey foot, one of those tendons, one of those little feet, is from the semitendinosus. So semitendinosus, he's coming from the back there at that ischial tuberosity. He's coming all the way down, crossing the coxal joint, crossing the knee joint, the tibiofemoral joint, and inserting at that proximal medial shaft of the tibia at that pes anserinus. So again, when he shortens, he's going to pull insertion towards the origin and insertion towards the origin. So again, that semitendinosus is going to flex that knee, extend that hip. So these hamstrings are shortening, and so they're causing a shortening of insertion towards origin, insertion towards origin. So into that ischial tuberosity. Flexion of the knee, extension of the hip. And then there's semimembranosus. So semimembranosus, once again, he's going to originate from that ischial tuberosity. So it's kind of nice that all three of them are going to share that origin. So ischial tuberosity, and then he's going to go all the way down to the medial condyle of the tibia. It's towards the back, so it's really the posterior medial condyle, the posterior aspect of the medial condyle. So the top of that tibia there is this nice lovely condyle, and he's inserting on the back of that in the middle, so towards the back and then towards the middle. So again, we're going to start ischial tuberosity is our origin, insertion proximal medial, the posterior medial condyle of the tibia. So again, we shorten that muscle, shorten, flex that knee, shorten some more, extend that hip. Flexion of the knee, extension of the hip. So you can also remember that all of your hamstrings are on the back of the thigh. They're going to create, therefore, a posterior movement, or the donkey kick, as you can kind of think of it. So all three of them, flex that hip and extend that hip, or flex the knee, extend the hip into a nice donkey kick backwards. Again, they're also going to cause a posterior tilt of the pelvis. So you can cause that posterior tilt by contracting them. And also when they're really tight, they will cause an automatic posterior tilt. That can also be a result of weakened quadriceps and of course weakened abdominals, because your abdominal muscles are going to help stabilize your torso and stabilize your pelvis. So tight is going to pull back. They also do have some play of rotation on the knee. So your medial ones, your semitendinosus, semimembranosus, have some medial rotation on that knee, and then biceps femoris has some lateral rotation, medial rotation versus lateral rotation on that knee. Of course, the knee joint is not a joint that does a whole lot of rotation, but it does have some move and some give. So they do also play a part in that as well. All right, guys, so those are our hamstrings. Back of the body, they cross the coxal joint, that hip joint, they cross the tibial-femoral joint, the knee joint. They're going to cause flexion and extension of the hip when they contract. They can also cause a posterior tilt of that pelvis, so the actual hip bones are going towards the back, posterior tilt, especially when they are tight or when your anterior muscles are in a weakened state. All right. Hopefully this was helpful for you. If there's anything else, any questions that you have, please feel free to drop a comment below. Let me know. And if there's anything else that you would like to hear about, also would love to hear that as well. And if you do enjoy these, please like and subscribe.